Hi, and welcome to another episode of Hot Takes with me, the Silver Fox, and the sharper-eyed amongst you may notice the very smart appearance I have today. Normally, I come home from work, get changed, then start making videos, after I've played with the dog and that. But today, I was running a bit late, and I thought I'll go straight up there. And there we are. And that is why you are seeing me in my well-dressedness. But today, we're going to talk about Harvard. Harvard University, of course, is one of the pinnacles of academic excellence, where the brightest of the bright, or at least the richest of the rich, can afford to go. They have started a course in their medical school, one of the best medical schools, it is said, in the world. But when you hear about this, it will make you wonder. This course is all about healthcare for the LGBTQIA+. Any other set of letters you feel should be added on there. But this is particularly about healthcare for that particular group of infants. That is to say, children who are between the birth and 1 year old. And they're looking after bis, trans, gay babies. This is Harvard. This is madness. Let's look at this article. So, I had to read this headline twice to make sure that I wasn't seeing things. Harvard Medical School offers course about healthcare for LGBTQIA+ infants, with the curriculum offering lessons in areas including obgyn, paediatrics, and plastic surgery. Now, I don't get this. Paediatrics, obviously, these are babies. Of course, it's paediatricians. And plastic surgery. Now, I'm presuming it won't be for things like, a 6-month-old looking at his cheeks and thinking, oh, getting a bit saggy here. I'm presuming it'll be congenital things like, a cleft palate or, things like that. Some actual physical thing that does need repairing and correcting. And that's fine. But obgyn, I get the mother needing that. But unless you're doing something to these particularly small girls, I don't see why that would be there. There's possibly a reason. I don't know. Not a doctor. But the worrying thing about this is they're catering for LGBTQIA blah, 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 plus. These are babies. They don't know what they are. They have no concept. So how on earth can they say whether they're gay or bi or trans or anything? It is beyond ridiculous. This has got nothing to do with the healthcare of very young children. This has got everything with providing a virtue signal to their probably mentally ill parents, or these women who have these babies simply as fashion accessories, and that is the very worrying thing. But we'll go into this. The course focuses on serving sexual minority people across the lifespan. How do you know these babies are that? It's run in conjunction with several Boston area hospitals. I suggest that the people working for these hospitals need to be investigated. The hospitals affiliated included Mass General and Boston's Children's Hospital. And in 2022, the Children's Hospital said kids know they're transgender in the womb. Now, I have seen, close to me, in fact, there are stables. And so in my time, I've seen an absolute huge amount of horse shit. But nothing that rivals the moronic stupidity of that last line, that children know they're transgender in the womb. Anyone who claims to, if anyone works for Harvard has said that, they need to be fired, because they are obviously mad, stupid, ignorant, and a danger. So medical students at Harvard are being taught how to care for infant patients who identify as LGBTQIA+. Now, how does an infant know? How do they communicate that? Infants have only got two settings, sleep and cry. And they can't cry for anything other than attention or hunger. They don't cry because my nappy's the wrong colour, I'm a boy but I identify as a girl. What is wrong with these people? Anyway, students at the school, which is considered to be one of the foremost medical schools in the world, that will need a massive re-evaluation, So it will be given clinical exposure and education that will focus on serving gender and sexually minority people across the lifespan, from infants to older adults. And in Western medicine, the infant is considered that time is from birth to 12 months old. According to the description for caring for patients with diverse sexual orientations, gender identities and sex development, students will work in both hospitals and communities with the LGBT plus youth. Now, immediately that should stop. That is divisive. The human body is the human body. And when you go to see a doctor, he should not give one flying shit whether you identify as male or female, whether you're boy or girl, whether you eat rice on Tuesdays. He doesn't give a shit, because ultimately all human bodies are exactly the same, with exceptions of blood chemistry because you're male or female, or physical differences assigned because of the sexes. Not because of your gender, not because of what you feel you need to be. Simply, you are a slab of meat and you are either type X or type Y. And it doesn't matter what your feelings are or how you identify. The doctor doesn't give a shit what you think. He's looking at your body and saying, this is what's wrong with your male body. This is what's wrong with your female body. Oh, but I'm a man, doctor. Yeah, that's great. So you don't have cervical cancer then. Great. Get out of here. Go and die of cervical cancer elsewhere, because I can't treat men with cervical cancer. Off you go. Bye. There you go. And that'll solve the problem, because then when they all drop dead of cervical cancer, that won't be an issue anymore, because they're men. Obviously, they don't have cervical cancer. That's how this is being addressed. These people are so fucking stupid. But amongst the hospitals involved in the programme is the Boston's Children's Hospital, home to the first paediatric and adolescents transgender health programme in the United States. The directors of the programme are Dr. Alex Karuglian and Dr. Alberto Pug. Don't know how that's pronounced, but I guarantee they're in it for the money. There's no consideration to the care of the patient. They specialise in diseases of the rich. Students will work in all areas of adolescent medicine: endocrinology, family practice, infectious diseases, obgyn, paediatrics, psychiatry, blah, 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 whole list. In addition, students learn about advocacy with regard to these trans issues, alphabet issues. A spokesman for Harvard Medical School provided the Daily Mail with this statement. Oh boy. As part of our MD curriculum, Harvard Medical School offers a 4-week elective course that educates and trains medical students to provide high-quality, culturally responsive care for patients with diverse sexual orientations, gender identities, and sex development across an age spectrum. Why? A doctor should not need to be bothered about how you identify. He should be bothered about curing your illness. And that is it. In this context, care for infants refers specifically to physical variations in sex development that arise in utero and are present at birth, i.e., are you male or are you female? These include chromosomal, gonadal and anatomical variations. The variations being, oh look, he's got a winky, or oh no, he hasn't got a winky, that makes him a her. Yes, I know that about 1 in a million there's a differential. It's still binary. You don't become a third sex. You are both sexes of the 2 binary sexes, and then basically, according to the doctor's needs and advice, the one is chosen. And strangely enough, in cases like that, it is usually female. But that's because it's easier to cut something off than it is to build something up. But that's a different video for a different day. This course aligns with Harvard Medical School's Sexual and Gender Minority Health Initiative, a myth. And its educational framework is based on recommendations of the Association of Medical Colleges. Blah, 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 all bullshit bollocks. Because basically what they're saying is here, we've got to provide this because we don't want to look like we're phobes and ists. And we're going to have, not children, because the children don't know, but we're going to have adults with developmental learning difficulties who somehow think that because they want something hard enough, it will become true. So they're going to turn up being, oh, but I'm a lady. Okay, well, get your cock out and I'll have a look at your lady's cock, and things like that. But these people are mental, but they need to be apparently, it needs normal people to go along with their delusions so that they don't feel bad. Well, it's madness and it's wrong. And when you're doing this to children and you are pandering to the whims of parents, which may ultimately damage children, then the social services need to be called. Those children need to be taken from the parents and raised in a safe environment, because those parents are damaging those children. And Harvard is pandering to these weirdos, to these mentally ill, delusional, dangerous people, and they are conniving in the harm for children. Harvard should be ashamed. I'm going to finish there and come up. Why does this folly continue? No real doctor would ever consider this to be real. What they're actually doing is aiding and assisting delusional people. They're reinforcing those delusions by allowing these people to think that this is normal in any way, shape or form. Any intelligent person, now we've got to presume doctors are intelligent. I mean, sometimes they make stupid mistakes, but they've got to be intelligent enough to get to the point where they can make those stupid mistakes. So we've got to give them the benefit that they are intelligent people. But no intelligent person can honestly believe that an embryo in the womb can possibly know that it's trans. And even so, you're going to have a difficulty then, aren't you? At what age do you start referring to that embryo in the womb as he or she, regardless of what you can physically see under a scan? It is beyond a joke. It is stupid, and it needs to be rejected. And we need to tell these mentally ill people enough is enough. And to use the correct term, really, that 99.99% of people would probably agree with, is that you tell these people to fuck off. And that is the only way we're going to deal with it. And they can sit and they can cry and they can do what they like, and we don't care. We provide them with the telephone number of a very good psychiatrist and tell them to seek professional help. But that's that. I'm not going to go any more on it. So there we go. That's the end of it. Thank you very much for listening. If you like what you're seeing here on the channel, please hit that subscribe button if you haven't already. Ring that bell for notification of future outputs. Leave a like, leave a comment, share the video. And until next time, stay safe, stay well, don't call embryos things they ain't, and goodbye.